Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology in Portland, Oregon, coming to you today with another segment. And I wanted to talk to you again today about suprapubic tubes. And we talked about this previously a few weeks ago, about what a suprapubic tube is. And it is actually just a regular catheter that goes in just above the pubic bone, so just above the pubic bone on the belly. And what this does, this is just a regular catheter that goes into the bladder, only it goes through the abdomen and it sits there, and you can continuously drain urine from the bladder, or you can plug it and keep it wound up underneath your clothing and nobody even knows that you have it, but you can use it to empty your bladder ever so often. Well, I want to talk to you today about some of the uses for a suprapubic tube besides just draining the bladder. Now, certainly we have to have a way to drain the bladder, so if you can't pee or you're having a lot of trouble getting your bladder completely emptied, sometimes a suprapubic tube is in order, and they can be as permanent or as temporary as you want them to be. For instance, if we're using them for a temporary purpose, such as giving the bladder a rest after surgery, or in some instances with my patients, what we will do is place a suprapubic tube into the bladder so that we can wash the bladder out with antibiotic irrigation for those patients who suffer from recurrent urinary tract infections. This is a way, actually a temporary way, or even a permanent way, to allow the bladder to completely drain and prevent bacteria from accumulating in the bladder. So what we do is the tube stays in place and the patient or a caregiver has a container of antibiotic solution, draws that up with a big syringe, and then inserts the syringe into the end of the catheter and pushes the antibiotic solution into the bladder. They will then disconnect the syringe and put a plug in the end of the tube. And this will allow the antibiotic solution to sit in the bladder for as long as we need it to sit there. And then, once it's sat there long enough, you unplug the tube and you just empty your bladder into the toilet. So this can be a very good way to help combat recurrent urinary tract infections for those patients who can't tolerate antibiotics or have multiple antibiotic allergies, or in the case of a patient that I had been on so many antibiotics that they developed a colon infection called C. difficile. So in that instance, you don't want that patient on oral antibiotics again, and we have to have a way to keep the bacteria in the bladder from causing a problem. And by flushing antibiotic solution into the bladder, that's a way that we can circumvent needing to give a patient oral antibiotics. So this is just one of the many uses for a suprapubic tube. I hope this helps. And if you're in a situation where you need to wash the bladder out with antibiotic solution, or perhaps you're a caregiver who is taking care of somebody who has poor mobility or might not be the best candidate to go and have multiple procedures done in an office, this might be a good option for you. So as always, I hope this helps. Keep writing in with your questions, everyone, and as always, thanks for letting 360 Pelvic Health help restore your confidence.